Hello, Croeso, and good evening. Welcome to Pilates Back Care, and today we're going to do some specific work on your pelvic floor. Now, I've asked you to bring a chair. What I forgot to do is ask you to bring a towel and, if you want, a mat and a band. Okay, so we're going to do a series of different exercises to work the pelvic floor. We're going to do some in a standing position, some with the chair, some sitting on the chair, and some on the floor. And remember to stay warm for this. And I would say, having taught pelvic floor exercises for such a long time now, it's never easy, okay? So what happens with a muscle is that when you have an injury to any muscle in your body, okay, it doesn't have to be your pelvic floor. When you have an injury to your muscle, it goes into a spasm and then it forgets what to do. So I don't know whether you've ever broken your hand or anything like that, and it takes ages to get that full mobility back. So even when your plaster cast is off after 8 weeks, you might find it might take another year for your full mobility and strength to come back to your hand. So if you think that you've had an operation, so say like you've had a hip replacement, let's just go quickly through a hip replacement. What happens is they cut here, okay? They're supposed to move the piriformis out of the way, but the piriformis is attached directly onto the hip joint. They then saw your leg off here, detach your piriformis muscle, cement the metal piece in, and attach the piriformis back onto the metal part, okay? Some of it attaches onto the bone because it needs the bone to grow properly, but some of it attaches onto the metal part as well, and they bind it with ligamentation that you've already got in your joint. So, you know, they use it like, so it's like a similar substance. And it can be quite traumatic for your pelvic floor to go through that operation and then for you to say like, okay, just function as normal. When you've had children, okay, everything just stretches out and it never goes back the same. Okay, it doesn't care what anybody says. They say you have a 1% prolapse for every child you have. So if you've had more than one child, then you've got excess amount of prolapse. If you've had a hysterectomy, it depends on how significant the hysterectomy is, but the womb is held in place like a balloon, you know, with tethers around it, with ligamentation to hold the womb in its correct positioning. To take the womb out, they cut those ligamentations, remove the womb, and so your body has to get used to the space. But the womb is then also connected onto the vagina, yeah, with your cervix. Sometimes they leave the cervix in place, sometimes they remove the cervix as well. Now what they do is they take one of the ligaments that held your womb in place and attach it to the top of your vagina or your cervix, and then that's still connected to your back. So if you've had that kind of operation, there's no way your pelvic floor muscle is going to be exactly the same. If you've had prostate cancer, the prostate, if you think where the testicles are, so it's nothing to do with the testicles at all, but there is a gland that sits between the testicles and the penis, and it sits against the urethra, okay? It doesn't really influence that. But in order to remove that, they either give it like little dots of laser therapy to shrink it down, or they can give a seed into it to shrink it down, or they cut it out. So, and again, just getting into that cuts through the pelvic floor muscle. So don't kind of think like, you know, you can get over your trauma. Now, sometimes you've had none of these things and you still have a rubbish pelvic floor. And this can be linked to arthritis or being hypermobile. So if you think about joints and the way that the joints move, you can have two types of arthritis. You can have osteoarthritis, where you get increased bone spurs, or you can have rheumatoid arthritis, which is arthritis of the joint itself, in particular the cartilage. Or you can have hypermobility, where the cartilage isn't particularly formed in the correct way, which means it's more slippery. it's not the right word for it, but it means that your joint can move easily. So if you're somebody, when you hold your arm out, your elbow bends inwards or your knees swing backwards, or you can do the splits without thinking, then you're probably hypermobile. And that also means it affects the pelvic area. So your pelvic area is not stable. You're more likely to get back issues, but you're also more likely to get pelvic floor issues. All of these things mean that we can't kind of go do that exercise and that will cure your pelvic floor muscle, okay? Because you have to try all different kinds of things. You might have to do some stretching and some strengthening. But it's the same if you break your arm. You can't just say, I'll just do one exercise and that will fix it, because it doesn't work like that. So don't panic, okay? I used to do a 6-week course on this. Don't panic that after one 40-minute session, or maybe 35 minutes at this rate, you're going to suddenly be able to work your pelvic floor correctly. It takes practice. As many things that I'm working on is the Menopause Boost course, which is still not launched, even though I started it in October last year, and Pilates pelvic floor course, which I've taught online and I've taught in person. And I just feel that for me, it is a huge barrier to exercise for many people. It causes lower back pain. And if you have the incontinence, it causes issues to do with mental health and well-being, in terms of your confidence, in terms of, you know, how you feel about yourself. And for some people, operation is the only answer. All right, so you can have an operation to kind of put it back together, but then you tend to have scar tissue. And once you've had that operation and you have scar tissue, remember you might have scar tissue from your hip, you might have scar tissue from prostate cancer, you might have scar tissue from removal of your womb or your cervix, then that scar tissue can become what they call keloid. So it becomes that kind of ridge here. You know, I'm always going on about this. And everybody goes like, you've got to massage it. And I find it really hard. But if that scar tissue is internal, you know, are you going to massage it? So we need to find ways to stretch that muscle and let it give a little bit. There's some really interesting research in terms of the apron that you get. And you can probably see mine from my hysterectomy, where I have like a little bulge here. Okay, so it's not like it's because the scar tissue's gone in. So you can see on this part in particular compared to this part, probably not with black leggings on, but maybe when I've got my light leggings on, it is that the pouching is not necessarily that you've got excess fat, although I do have. It's not necessarily you've got excess fat. It's because the scar tissue has gone so tight inside, it's kind of rushed everything up. So you need to have A, an open mind, B, be prepared to get hands-on to the areas that we're going to be working. You don't have to be internal, okay? And have patience when we're doing that. So the reason that we use the chair is a really great way to start to work the pelvic floor, especially if you're not sure, because you can sit on it. And I used to love working with the big blue balls, yeah, that we used to have in the sports centre. So we're going to start with the chair. I'm going to put very quiet music on in the background. It's a bit woo music, but hey, I'm hoping it will be gentle enough, because there's a lot of research around how this kind of music, it's got a certain vibration level that allows your blood pressure to come down a little bit, because what I don't want you to be is to be anxious when we're trying to do these exercises. And for me, being online is such a bonus here now, because you can do this without having to feel like you're sharing the room with anybody else. So we're going to go through a normal warm-up standing position, and we're going to do the magnetic field kind of imagery. And I'm sorry that I haven't put the PowerPoint up, because I can't get it to load. And I just went like, just leave it, Rachel. I've had a busy day. So the pelvic floor muscles are diamond shape, okay? There's more than one, and they're diamond shaped like this. But I want you to think about north, south, east and west. And remember, levator ani attaches onto either side of the coccyx and moves forward towards the front of the pelvis. Now, it doesn't attach onto the front of the pelvis because that's the space for your bladder and your womb and things like that. So there's a little hole bit there. It's not a hole, but there's like no muscle because you don't really want muscle pushing onto those organs. So it kind of attaches into like a flat piece. And you want to then think about drawing north and south together. Okay, and you also then want to think about drawing east to west in. So we're going to start with that. So again, your gait and your feet and your foot position is so important for pelvic floor because the nerve fibre from your pelvic floor comes directly down the inside of your leg and onto your big toe. So right? Every time I say that, I think of Fergie. And if you're my age, you know what I'm talking about. Push your big toe down and you should feel that connection through to your pelvic floor. So you want to roll your shoulders up, back and down, and we're going to do our normal breathing. Now the breathing pattern helps us to release any tension in the pelvic floor and helps us to focus on the pelvic floor. So if you're anxious and you're a bit nervous, when you breathe in like this, what happens is your pelvic floor stretches a little bit, okay? It's not a massive stretch. And then when you breathe out, as you breathe out and you pull your stomach in, your pelvic floor kind of comes back in a concertina fashion. It's not a big movement. So when you're practicing your Pilates, on that breath in, feel the pelvic floor stretch and release. And then on the breath out, feel like you're trying to create a little bit of tone into that muscle. Okay, and again, one more time, deep breath in. And then you want to take that slow breath out. Okay, so thinking about front and back, I'm going to ask you to put your hand onto your stomach and your hand onto your back. And it's easier to do it like that position. So when you're doing north to south, think about drawing your hands closer together as if they are two magnets. So it's not like a tight squeeze. You want to feel like they're attracted towards each other. And then release. And again, if you can, breathe out as you try and draw them in. Now you should feel your stomach muscles come in a little bit, and then as you breathe out you should feel that connection just relax a little bit. Give me one more time, breathe in. And this is just the simplest and easiest way to start to focus on your pelvic floor. Okay, same thing, put your hands onto your hips, take a deep breath in, and then breathe out. And feel like you're trying to draw your hands closer together, okay? And then release and feel the hands just relaxing apart. Okay, they're not going to move anywhere, but you're going to have that sensation. Deep breath in, breathe out, hands closer together. So remember, on the in-breath, your pelvic floor releases. Okay, and then again. And then release. Which is why, when you sneeze, you want to go, okay, because we'll talk about when you stretch it, you can contract faster. And it's also, if you've got problems with your pelvic floor, and your problems evacuating, you do the same breath when you want to go to the toilet. Okay. Now we're going to do that hip movement side to side. So we've been doing this in class all week. It works really well to place your hands onto your back here. Okay, and it's the kind of movement you will do when you get this kind of low grumbling chronic back pain that could be your pelvic floor muscles, like your piriformis, that are grumbling and not really the spine itself. Okay, and then release. Okay, so you're going to bend your knees and just move your arm. Now this is just general warming up just to let your body kind of be distracted and let your body relax. Now I want you to bend your knees. So each time you're going down like this, your pelvic floor is having a stretch. And when you come back up, your pelvic floor has that little bit of tension. So watch the tailbone. So the tailbone comes back, pelvic floor relaxes, pelvic floor tense. So you kind of have a stretch and release. Okay, stretch and release. Yeah? So just feel a little bit of tension. And when you stand up, think about north to south. Yeah, pulling in. And again, one more time. Better do the other arm. Oh, please don't let me have a coughing fit again. Here we go. Reach up. I think I'm going to have to invest into a microphone because obviously at week 4, in all my cafes, I have the croak. And again. Okay, taking your feet up slightly wider. Now in this position, this is where the floor is a little bit more stretched. So as well as north to south, you have that east to west positioning. So when you're doing your east to west movements here now, you have a different feeling through the hips. And if you're one of the people with a hip replacement, this can feel quite clunky and challenging. All right, so let's try and think about it. Now try and do that circle. Now you're not trying to do a circle with your waist. What you're trying to do is to think about going to the east, coming to the north, and then going to the west, and then going to the south. And it's not quite a circle because it's quite flat at the front, and you can kind of do a big circle around the back. Then reverse it. Let your knees bend and relax, but try and keep your feet flat onto the floor. Okay, so we're going to take opposite hand here, and then opposite hand on this side. Now this rotational work works through the upper body and the diaphragm, but your diaphragm here, okay, works with the diaphragm of the pelvic floor. So when you're twisting this way, you're going to get a corresponding twisting movement, yeah, with the pelvic floor. You might not feel it, but if you've got scar tissue, you might find that when you're moving this way, the restriction is low rather than high. Okay, so have a little go of that. And again. All right, hands onto the side. Now again, moving the spine, okay, and letting your body relax. But again, if you've got scar tissue around the hip, you might find that you have some kind of impingement as you're moving from one side to the other. Okay, so you're going to get your chair to begin with. And I'm not going to spend ages on the chair, but this is an exercise I've shown you previously, which is a really good way if you have a very tight pelvic floor that's causing you real kind of dragging pain into that pelvic floor area, or you know, you can sit on the low and you can't wee and you can't poo. This is a good exercise. So you roll your towel up and you sit on it. Okay, so you make sure that it's in the correct place, you know where it is. And you want to kind of have your feet flat onto the floor, and then you want to do east to west. All right, so I'm going to turn this way now. And what you want to do is to go east and then west. So you kind of drop your hip on one side and drop your hip on the other side. And you should be really conscious of where the towel is. Don't have a massive towel, okay, because it can be really uncomfortable. Then you can just lean forward and lean back a little bit, okay, you don't go too far, and then you do the breathe in. So you want to go breathe in and then breathe out. And what you want to do is when you breathe in, remember that's the relaxing phase, you want to feel that the pelvic floor presses against the towel. Then when you breathe out, you want to feel that you're lifting away from the towel. Okay, so breathe in, breathe out, and then release. So you can do that exercise without the towel, and it really helps in this place to sit onto the edge of your seat, okay? And what we're going to do is we're going to slump back. Remember, slumping causes that downward pressure through the pelvic floor, so try not to spend hours sitting in the car like this because it's quite, you know, taxing. And then you're going to sit up and pull your chest up. So you're going to tuck your chin in because all of these muscles are connected, and then lift your chin up. And then again, turn down, and then up. So you can start to see a pattern here where you're doing that north, south, east, west, but on a chair. It's not easy to do this on a soft chair, okay? A dining room chair is a good thing to do. The next phase is to use the chair or the wall. So I'm going to show you the wall one first. And this is a really great way. You still need your towel for this. I'm going to shout and hope I don't have a coughing fit. Okay, so there's two exercises here. Number one is to have your feet flat against the wall in the dead bug position, okay? And you want to try and think about drawing north to south in this position here. So when your feet are flat against the wall, have your hands down by your side in the dead bug position. Take a breath in. You breathe out. Try and do what's called the Kegel exercises. So north to south, or you can do east to west, or you can do all things together like a compass coming into the center. But you can also help your body to relax and get rid of any excess fluid that can collect into your legs and into your lower abdomen because these muscles are tight. And all you do is you rest your legs against the floor. But it really helps to have a rolled up towel or cushion underneath your pelvis and let your legs relax here. Now you don't have to do anything. Okay, it's a lovely exercise. You can just stay here for 5 minutes. So if you find you've got puffy feet or your legs feel tired, remember sometimes this disturbed circulation is because the pelvic floor is holding on to too much tension. And this kind of exercise is just so good for you. Whether you've had a hip replacement, prostate cancer, C-section, just had a baby, or you're just old and tired, try that one out. You can then do this on the chair. Now the reason I'm showing you both is this. When you have your feet pressed against something, it's called a closed chain exercise. Because the feet have so many nerve endings in it, it feeds back a different message to the brain and the body about when things are touching the feet or not. So when your feet against the wall, you get a good reaction. I think a better reaction than when you're on the chair. If you're on the chair or you can't find a wall space, then this is a nice way of doing the exercise. So hands down by your side. And again, it's the same thing. Take a deep breath in and then just think about bringing north to south together or east to west, or feel like it's a compass point all coming in together, and then release. Just notice that you don't curl up your toes when you're doing it. Your eyes move, which is really interesting. But try not to scrunch your toes. Okay. So the other most fantastic exercise is to do this in a bridge position. So you're going to try it in the bridge position, and then we're going to try it in the bridge position with hyperpressive breathing. All right. So when we're in the bridge position here, I quite often see people doing this where their feet and their toes are lifted. You remember we want to close the chain. So you can have your feet in line with your pelvis, okay, so knees to hips, or you can have your feet wider if you feel it more comfortable, or you can have your feet narrower. And this is all to do with the position of the hip joint in the hip socket, okay? And you might have to experiment with how this works for you. Hands are down by your side. The procedure, I don't think it's not the right word, procedure. The steps you take are slightly different. So you go breathe in, breathe out for abs. But when we're doing the Kegel exercises here, you don't contract on breath, okay? So you just want to think about contracting without breathing out and working the abs. So you need to now think about just squeezing north to south and east to west without doing any deep breathing and without having any contraction through the abdominal muscles. All right, so it kind of goes squeeze and then breathe out and tighten your abs. Now what will happen is that you can squeeze and tighten your pelvic floor for about 5 seconds, and it kind of wanes away, and then your abs take over. Now they work together, okay, because those muscles are connected in terms of stitching. So we're only going to be doing this 5-second contraction through the pelvic floor before the abs do the work when we're doing the bridge position. If you're finding it challenging to even get your pelvic floor to contract for 1 second, you keep practicing that 1 second contraction until you feel more confident, okay? All right, so feet are down. You take a deep breath in. No, you don't. Don't listen to me. It's just habit. Feet are down. Do your pelvic floor contraction. Then take a breath in. And then the breath out. And then push down on the feet and lift the hips. Now you want to feel, when you're doing this press, quite often we talk about pushing the feet down, okay, because we know the feet are important to us. But I want you to think about pushing the feet down and pushing the tailbone up. So think about where your tailbone is, okay, it's roughly at the top of the crack of your bum. You want to push that up to the ceiling. You don't want to overarch your upper body. You want to keep your upper body fairly flat. You can push through the pelvis, you can push your belly up, but you still want to tuck your tailbone underneath. I don't know if you can see, you don't want to have your bottom relaxed down. Okay? And then you roll down. Now when we're in the up position, you're going to do north to south in 1 second beats for 5 goes. Okay, so think of it like a lighthouse, you know, flashing on and off. So feet are down, connect your pelvic floor, breath in, breath out, up you come. Now when you're here, tailbone lifted, and then do squeeze in, but not working the abs, okay? So don't do the abs, just do squeezing of your pelvic floor. Like, remember, light on, light off, light on, light off, light on, light off, and then lower your body down in 1 go. Now you might be saying, yeah, but I can feel it here. And remember now, your piriformis is part of the pelvic floor. Okay, it's going to help to support your pelvic floor. So you want that feeling to be there as well. This time, you're going to do 4 lots of a 5-second hold. If you can't do the 5-second hold, just do as many seconds as you can. So connect the pelvic floor. Okay? Connect the pelvic floor. Excuse me. What I didn't tell you once was I was teaching Pilates once after walking the dogs, and I found a tick in my hair. I didn't say anything at the time, but now I'm freaked out when I lie down on the floor and I feel something tickling me. But it wasn't. It wasn't a tick. We're all right. Here we go. Squeeze and tighten. Tighten the abs. Lift up. Now, you don't want to squeeze. You don't want to tighten everything here. You want to keep your feet flat onto the floor. You want to feel like your tailbone's going up, and you want to think about drawing through, drawing in, north to south or east to west, whichever works for you. Hold, 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 then let go. And again, hold, 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 hold. And the beauty of this is that you can do this in class without anybody knowing you're doing your pelvic floor. Okay, and then again. So you want to go hold, north to south, think about pulling into the centre. I often think of it like the drawstring one that we do around your belly, but you're doing it with your pelvic floor muscles. And then again, one more time, and then release down. Okay, so frog stretch is a great way to start to release the tension through the hip area. But if you do have scar tissue, what you can do is when you're doing this is to push onto the scar tissue where you've maybe had a C-section, you've had a hysterectomy, yeah? We'll show you different ones in a minute. Okay, so you just want to just ease that out. So you can just do a rubbing as you're doing this exercise. Then this one, the piriformis stretch, is great. And again, if you can do the rubbing area, so think about where your hip bone is and your sacrum. It wants to be on the diagonal, okay, this way. So you want to rub that direction along the muscle fibre. You can rub up and down, but it's not as effective as rubbing that way. If you have the scar will be this way, so you do rub that way onto the scar. Okay, let's just do the other side. Whoop, running out of time. Okay, so if you can, piriformis is here. We're going to repeat this one in a minute. If you've got the scar, then you go over the scar tissue like this. Okay, I'm going to stay here because the other thing we can do is what's called trigger point. Now you have here a collection of nerves, all right, so they work around the hip into the pelvic floor. And you want to just tap your finger and find a bit that feels really tight. And then you just keep tap, 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 tap in. Okay, so you want to tap, 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 tap in. And then back to the centre. And then the other way you can do it is you use your towel and you push that onto where the scar is. Now we've used this with the ball, yeah, so you can have it there and you can just rest your hip against that. And what's happening is it's resting against your piriformis, opening up through the hip. And again, you can work into that scar tissue if you have scar tissue there. If you don't have scar tissue, you don't have to do it. Okay, and then release. All right, so the other good way to do it is into prone position here. What I want to do really is to get you to do hyperpressive breathing. So we did this the other day, but we'll just refresh it now. Find your sternum. At the end of your sternum, you have what's called the xiphoid process. If you remember from biology school, it's like a little tongue, I always think, sticking down. So this is the area we really want to focus on because this is the attachment point for these abdominal muscles to work. The chest muscles help to lift the chest as well, but the abdominal muscles and the diaphragm do most of the work. So think about where you'd have your six pack and then take your hands just away from that and then lift so your hands are cupping the lower part of your rib. So you take a deep breath in, feel the ribs expand, breathe out and you tighten. Now I always think about doing the xiphoid process as if it's a button and you want to tighten it there. Now you take a breath in without chest expansion. What happens is you use this area and it draws the pelvic floor up. Okay, so you want to go breath in, breath out, breath in, breath out. And as you do that second breath out, you get that lift in the pelvic floor. And this is so helpful, especially if you have any kind of prolapse. And if you kind of go like, oh, I don't have a prolapse. If you've had a child, you have a slight prolapse, okay? It doesn't have to be a massive one. So when we're going into the exercises, I want you to do the exercises first without the hyperpressive breathing and then with the hyperpressive breathing, because the hyperpressive breathing is going to help you be more stable anyway. All right. So, onto your hands and knees, rolling your shoulders back and down, tucking your chin in, taking a breath in as you breathe out, hold and lift your abdominal muscles. Take your right foot back, take your left hand slightly forwards. Don't tell me I've got the wrong arm and leg, I know, okay? Then you're going to lift them up until you feel your glutes working. So you want your glutes to work, you don't want to give into your back. And then you're going to tap it down, lift it up, tap it down, lift it up, and again, tap it down, lift it up. Sit back down into your child's pose. As you're doing that, I'm just going to move my chair. I have extremely long legs, you know. Okay, so we're going to repeat that exercise on the same side with a hyperpressive breather. So when you're here, you go breathe in, breathe out, hold and lift your abs, and then you keep that tightness, and you go breathe in through your back, breathe out, and feel like you're pulling up your pelvic floor. Now what you should find is that you are more stable, your hip is more stable, and that your abdominal muscles are contracted a little bit better. So this is working through the core, and again one more time, and then release. Okay, so in the child's pose here, this is a great way to release the pelvic floor. So again, you want to have your head onto the floor. I want you to stay with your head down, but you can't hear me if my head's down. And as you're there, I want you to think about north and south kind of getting wider apart, and also east to west. So if you think about that diamond-shaped pelvic floor muscle, it just opens up. Now you can just release into it by moving your hips in that east and west position as we did before, or you can sink your belly down to the floor, and that kind of release through the abdominal muscles releases through those internal organs a little bit. Okay, let's come back up. We're now going to do the other leg, and we're going to repeat the same way. So only abs. Okay, so taking a deep breath in, breathe out, hold your abs in tight, and you're going to do 5 lift and lower. You want to lift your leg high enough to feel those muscles contract. Up and down and again, up and down and again, up and down. Sit back into your child's pose. Let your body release down. Okay, so this is the hyperpressive breathing. Okay, so you're going to take a deep breath in, breathe out, hold and lift. Keep your stomach muscles in tight, take another breath in, another breath out, and then try and work through the pelvic floor. Opposite arm and leg away, and again, try and feel when you're lifting that arm and leg that you're trying to keep that north to south connection, or feel like you're pulling that tailbone under a little bit. And then release down and go back into your stretch here. Okay. So just to finish off with, we're going to come up to a standing position. I need you to get your chair or have something to hold on to. So for this one, you're going to have your chair this way round, and we're going to repeat that exercise in this position here. And the reason for this is sometimes I find that people's core strength means they're unable to do a real leg lift, and the real leg lift has got some really good, important ways to help to strengthen your pelvic floor. So holding onto your chair, you step 1 foot forward and 1 foot back, as if we're doing standing Pilates, and you're going to lift and lower. You can do the arm as well, okay, but it enables you to stay in that upright position without kind of wiggling around onto it. So we're going to try that again on the other side with the hyperpressive breathing. So 1 foot forward, 1 foot back. Have both hands on if you want to. Take a deep breath in, breathe out, hold, and then take another deep breath in, and then breathe out, and bring up your pelvic floor. Now what you'll find is when you're doing this now, you'll be able to focus more onto that hip movement. Okay, so it's not a big movement, remember. So you just lift and lower. If you want to do the arm as well, you can do. And again, one more time. Okay. And then the final thing you can do with your chair here is to take your feet apart and squat. Okay, so the squat position is really good for releasing. So you want to do that east to west, and you can help release tension through the pelvic floor. Now, by holding onto the chair, so you're not like doing it to work the thighs, You're doing it to kind of release the thighs down. You can let your body hang and you can sink down lower. Now, I can't sink very low, okay, I'm not built for it, but if you can't sink down low, this is what my physio was trying to tell me to do. Get your hands on the floor and your hands on the inside of your knees. That is a good way to stretch your pelvic floor. But if you haven't got good balance, it's really hard to do. So you sink down, you can move, and then you can use your chair to come back up. Sometimes your knees will stop you doing it. And if that's the case, take 1 foot forward, 1 foot back, okay? Come down and turn your knee out. Watch again. Ooh, don't pull on your chair like that. Turn your knee out. But really, the lower you can sink down to the floor, the better that becomes. And this is the last, this is the last little bit here. So we quite often do this exercise in standing Pilates, which is to take your foot across here to work through your piriformis. I'm just going to turn to the side so you can see. So when you bring your knee in, this bit here wants to move into a stretch. So you want to press that knee down and out. Ideally, you don't want to push onto the knee joint, but you want to press between the knee and the thigh. Hold this into place. Now sit up tall and then lean to me like I've got a flower that you want to smell, and then lean down on your arm. Now if you've got a hip replacement, don't lean, okay, just lean forward. And if you want to, then tuck your chin in and then release. Okay, just try onto the other side. So, okay, I've done too many clickety clacks this week. My piriformis is going, oh! Okay, so lean to me first and then lean. Now if you can, try and get your knee parallel to the floor. I can't today, I'm in pain. And then release. When we showed you the squats, you can do the squats in this position, or you can turn the chair around and do the other position, and you can lean forwards if you want to. Right, so sitting, are we sitting nicely? Feet at distance apart. When we talked about the different kinds of incontinence, sometimes getting up out of your chair is a real big issue, because as you roll forwards, you can sometimes find that that triggers that release of urine. And I know a lot of women will come to the side of the chair and come up with their legs together, or they'll step 1 foot forward and 1 foot back, and both of those work really well. But we're going to try and just do our hyperpressive breathing to help us. Okay, taking a deep breath in, breathe out, hold your belly in tight, take another breath in, breathe out, and then stand up. Okay, so remember, feet hip distance apart. You really want to feel connected to the floor. You want to feel that you are pulling the hips forward and pulling that tailbone underneath, and then lifting up here. So you don't want to have a super, super tight contraction. You want to feel that gentle kind of easing together. All right, so deep breath in, let the pelvic floor relax. And then that slow breath out. And then release. Deep breath in. And then that slow breath out. Last time, deep breath in, bringing your hands together, bringing it in and down. So remember, always be kind to yourself when we deal with pelvic floor issues, and don't feel like it is fixed, okay, because it doesn't really fix. It has to, you have to keep working at it, and especially if you're female, because a lot to do with the pelvic floor is to do with the fact that estrogen controls the kind of, I don't want to say tension, I would say condition of the muscle and the urethra. So if you're not on HRT, it's year on year, it will get worse. So you have to counterbalance that with training. okay? Other things you can do, nice and gentle things you can do. Make sure you never get constipated, so make sure that you eat well, that you have a sufficient amount of fibre in your diet, both soluble and insoluble, that you're well hydrated. Think about, I suppose, your sleeping pattern, because stress has a huge impact on your pelvic floor. And you know, it can get a little bit more irritated. So if you're somebody who's having kind of constant urine infections or bladder infections, then have a look at your sleeping and stress, as well as all the other things to carry on. And you know, just kind of have a journal about it and see how it goes. There are sheets that you can use, stuff like that. Okay, I've overrun. As usual, I could talk about this for hours. I will try and get that PowerPoint up as a PDF because I can't get the PowerPoint to load. Facebook don't like it. And I'll speak to you soon. Take care. Hwyl fawr.